There are still some independent hospitals around the North Country, but much of the North Country's healthcare has been carved up and folded into bigger regional networks. You have Rochester Regional in St. Lawrence County, UVM Burlington in Plattsburgh in the Northeast chunk, Albany Med in Glens Falls in the Southeast. There are positives and negatives to these arrangements. One that's raising concerns is consolidation. It's leading to the closure of a blood center in Plattsburgh. That's today's story of the day.
Support for Story of the Day comes from the Wild Center in Tupper Lake, dedicated to strengthening visitors' connections to the natural world. More at wildcenter.org.
Hey, I'm David Sommerstein. It's Monday, July 6th. Hope you had a great holiday weekend. First up, opponents of a potential new nuclear reactor in St. Lawrence County rallied last week in Massena. Governor Kathy Hochul has laid out a plan to bring 5 gigawatts of nuclear power to upstate New York as a way to transition from fossil fuels to clean energy. Richard Haller reports.
A group of people held signs in front of Massena's town hall, launching a campaign that opposes nuclear energy in the North Country. It was part of many rallies that were organized across the state. The campaign's goal is to warn the public about the dangers of nuclear power. Ronnie Sunday, a member of Mohawks United Safety and Health, said at the rally that her people in Akwesasne have been facing industrial development for generations.
I stand confidently in my resistance to nuclear energy. 70% of all uranium deposits are found near or on indigenous lands, and many nations are paying the price that uranium is worth in more ways than one. How are we supposed to support nuclear when the legacy impacts are felt across all of Turtle Island?
The campaign launched in Massena because the town is currently being considered as a location for one of the state's proposed reactors. Assemblyman Scott Gray has been pushing for it, saying nuclear power will provide a steady source of clean energy and jobs that'll boost the local economy. But critics at the protest said that nuclear power will drive up energy costs and cause environmental damage, including a potential radioactive meltdown. The town is also considering a controversial proposed data center. Suzanne Patnode, a Massena resident, said that both go hand in hand and that the town should instead support renewable energy like solar and wind.
Why do we not fund our community first? We could all have green renewable power here in Massena, here in St. Lawrence County, and these companies could pay for it. But instead they want to buy up all of our land and run us out of our own property and our own home instead of making something that's beneficial to us.
Governor Hochul says only receptive, welcoming communities will be considered for new nuclear development. Last month, Hochul announced the launch of a new process to study how to build new nuclear in New York. Richard Haller, North Country Public Radio.
That's Richard Haller's first story as our new full-time St. Lawrence Valley reporter. Great to have him here. President Donald Trump signed an executive order last year banning collective bargaining at many federal agencies, citing security concerns. Senator Chuck Schumer was in central New York last week criticizing the ban, which impacts about 800 workers in Rome.
Trump administration is now trying to strip away their union rights, undermining one of the freedoms they fought to protect. That when veterans go to war, one of the freedoms they're protecting is the right to organize and the right for unions to represent them.
Schumer met with union workers and leaders in Rome and pushed to expand their collective bargaining rights. Randy Gorman reports for the New York Public News Network.
More than 1,000 employees in Rome who work with an agency that, among other things, processes payroll for the Defense Department are trying to get used to a working life without union representation. Schumer, who is the Senate's Democratic minority leader, says union representation makes federal agencies stronger.
Protecting labor rights doesn't hurt the quality of work. In fact, it helps by making it easier to hire and retain workers.
Mary Sharp is president of the union that had represented workers at the Defense Finance and Accounting Service in Rome. She says the move to nullify union representation has really hurt morale.
Supervisors are giving people a hard time taking their leave, their annual or sick leave, and they're just nitpicking a lot of things.
Schumer is pushing for legislation that would restore and protect collective bargaining rights for federal employees. In Utica, Randy Gorman for the New York Public News Network.
The longtime blood donor center in Plattsburgh is slated to close on Friday. Local hospital employees, elected officials, and community members say it'll be a big loss. As Kara Chapman reports, it comes amidst a trend of consolidation by regional healthcare systems.
Frank Dorrance of Morrisonville has donated platelets at the Adirondack Regional Blood Center for more than 20 years. He goes with his two best friends.
Between us, we've given over 700 platelet units, which is equivalent to about 4,200 regular donations that have to get spun down to come up with that many platelets.
Dorrance says they like helping people, and the blood center, located right in Plattsburgh, makes donating convenient. The center is operated by Champlain Valley Physicians Hospital. According to its website, it supplies 95% of the blood used at CVPH and supplies several other hospitals in the region. But CVPH plans to close the center on July 10th and shift blood acquisition to the American Red Cross. Center employees were among the more than 140 people laid off last month by University of Vermont Health, of which CVPH is a member. UVM Health is trying to close a $300 million budget gap over the next 3 years. The network expects this latest round of layoffs will save about $9.5 million annually. Currently, the Red Cross's nearest locations that can accept platelet donations are in Burlington and Albany. That could change, but Dorrance says for now, he and his fellow donors can't make that work.
We would be committing a day per donation instead of just taking some time in the early part of the day and being able to have a regular day. That's going to eliminate a lot of people's ability to go ahead and do these platelet red blood cell donations.
The impact on local platelet donations was one of many concerns raised at a speak out organized by the New York State Nurses Association Union at CVPH last week. The union says more than 1,000 people have signed a petition calling on UVM Health to reverse the decision to close the blood donor center. Blood center nurse Nancy Roberts, who's retiring when it closes, said she and her fellow employees have developed relationships with regular donors over the years.
That has allowed us to know who to call when we do have a situation where we are running low on a blood type because of a trauma or a high usage situation. We can call people, they come right in because they know us and they know that the blood is going to be used locally and that it's going to help their neighbors.
According to Roberts, CVPH has been providing its own blood for more than 50 years and supplying other hospitals for more than 30. She said she's worried that the lack of a local donor center will mean a delay in getting blood to patients who need it in an emergency, especially at the facilities in Malone, Saranac Lake, Elizabethtown, and Ticonderoga.
None of these places are a convenient stop on the Northway. You've got to make sure that you have the blood that you need for these patients, and they may suffer because of that lack of convenience.
In a statement, CVPH President Michelle LeBeau said the new collaboration with the Red Cross, quote, helps ensure a dependable blood supply and supports the hospital's long-term financial sustainability. She said when services are available through community partners, duplicating them, quote, diverts valuable expertise away from direct patient care where it is needed most. LeBeau added that each donor center employee who chose to stay with CVPH has found a position. Still, union members and their supporters see the blood center's closure as a pattern by UVM Health of closing healthcare services in the North Country. Candy Saucier is a nurse at Alice Hyde Medical Center in Malone. She said Alice Hyde used to do its own blood screening and typing in-house and maintained a small blood bank of its own. 4 years ago, UVM Health centralized that work at CVPH.
In the current system, a courier goes back and forth to Plattsburgh between Malone and Plattsburgh 4 times a day to pick up samples and deliver blood in return. This isn't convenient and it's not fast.
Saucier said CVPH had yet to provide details on how that system will change when the blood center closes.
We have a very small supply of blood on hand at Alice Hyde, 16 units at most. The average adult human has between 10 and 12 units of blood in their body. Our patients cannot afford for the blood supply to move even further away.
CVPH President Michelle LeBeau said that, separately from the blood donor center, the hospital's blood bank continues to test, screen, store, and distribute blood for UVM Health's New York hospitals. She said, quote, patients will have the life-saving blood they need when they need it. Roberts, the retiring nurse, said no matter what happens with the Adirondack Regional Blood Center,
I do hope people keep donating because there's always going to be a need. There's just no replacement for human blood.
But she said it's much more convenient to get when it's right up the road from the hospital. Kara Chapman, North Country Public Radio, Plattsburgh.
We have more news all the time on our website, ncpr.org. Music today by Mark Corey of Watertown and Caretaker of Canton. I'm David Summerstein, North Country Public Radio.